Airway and oxygenation are kind of our specialty in EMS. It's kind of one of the biggest things that we manage in the pre-hospital setting. Most common call, I would say, for the most part, is, in my region, is respiratory problems, breathing problems. We have a whole cabinet and a drawer and another one for pediatrics, so we are on top of oxygenating and ventilating patients. So let's talk about some of the stuff that we carry on our truck. So we'll start with the most basic, nasal cannula for delivering oxygen. This is not going to be anything crazy, just for patients that need a little bit of a bump. Maybe they're already on oxygen at home. For the most part, we don't use a lot of these. And the reason why we don't use a lot of those is because we have these. So if you're having an airway emergency, it's kind of important to monitor as many things as possible. So this is a CO2 nasal cannula or an end-tidal nasal cannula. We use these both to deliver oxygen, but also measure respiratory rate, depth, pattern, and how much CO2 the patient is exhaling. So these are amazing, and sometimes we use them without even needing to provide oxygen because it can tell us a lot of things about our patient's condition. Next is a non-rebreather mask. So this mask has a reservoir that fills with oxygen to make sure this patient is getting the most concentration of high flow O2 possible. These are typically used as a bridge. So we are trying to oxygenate this patient before we maybe move to a more invasive measure, maybe like CPAP, BiPAP, or even intubation. So these are going to give you a lot of O2 delivery. Let's move on to some medication administration options. So we have a nebulizer mask and a nebulizer pipe. Most of the time we're going to use the mask because we're dealing with sick patients. Some patients don't like the mask. It's a little claustrophobic. And we're going to go on a call. So those are our basic airway adjuncts. We will talk about some of our more invasive options when we are not running calls. So I'll see you guys later.